A little more than 10% of babies born in the United States are premature. Premature infants are delivered weeks before their expected due date. Special hospital units help these delicate babies develop before going home with their family. Neonatologist Durga Panda is here to talk about preemie babies. Thank you for joining us today. I'm so excited to have you.
Me too, Ashley.
Yeah, so what are considered premature babies?
Okay, let me give you a little more detail of how we define the whole thing. A normal human gestation is about 40 weeks, which counts to almost like nine months plus. Any baby born before 37 weeks, say maybe 8 months or 8 months plus, is considered term. Before that, any time starting from 24 to 37 weeks is considered premature. They have different kinds of prematurity, and most of the times we have what we call as late prematures, but we can have anywhere from 24, 23 weeks to 37 weeks called in the bracket of premature babies.
So there is different stages. What are the causes of premature babies?
There are multiple causes for premature babies. Many of them have been addressed already and still working on them. Many of the pregnancies as such can have reasons beyond their own controls and have to deliver them early. And multiple baby causes also cause the babies to come out a little early. So depending upon if it's the mother or the baby, or at times both, we can have premature births.
So we just saw pictures of just little tiny babies and just palms of people's hands. How small can a baby be and actually survive?
That is an excellent question, and going back to the same question again, the viability. It's a very open and very controversial question in the literature and in the medical circles of how premature is premature. And based on like just a general acceptability, about 23 to 24 weeks is what we call as viable. We've had some rare incidences where babies of 22 weeks or 21 weeks have survived, but in general about 23 weeks and 24 weeks are something that we count on definitely.
So anything in between that time, you can have a survival,
Correct.
a good survival rate. Are there ways to prevent an early term?
Definitely, and multiple organizations including March of Dimes are working very hard, and research is also based on that. Because what happens is in this era where a lot of onus is on the healthcare management and the health industry as such, we are trying to decrease the cost effectiveness or decrease the cost associated with any of these diseases. And premature being one of the major burdens, we are trying to prevent it rather than treat it. And March of Dimes is one of the organizations that has worked up quite a lot for this. Taking care of your pregnancy very well, the diet management, and following up with your obstetricians at times saves a lot of problems in the later part of handling premature babies. But in general, good diet, taking care of the pregnancy well, and timely follow-up with your OBGYN saves a lot.
Help saves a lot of life. After the baby is born, what is the process of keeping the baby alive? Is it rushed into an isolation, or how does that work?
Part of it is true. What happens is when the babies are born, they have their skins very friable or very delicate. So they lose water and electrolytes much faster than what we as adults do. So what we do is we take care of them in a specialized environment where everything is controlled. And many a times they end up being in isolates, which is a small little box where we control the environment in temperature, the air quality, the whole setup. And also give them nutrition and electrolytes through the IV route, which is not the most preferred route, but as their gut and other organs are not actually ready to handle it, we slowly transition them, almost giving the exact kind of environment as mom would do it in utero. It's not the same, as you understand, we have limitations, but the technology has grown to the level that we can sustain life as good, or should I say almost as good as what God provided.
Being in the womb almost.
Correct.
What are some of the emotions you and your team have to deal with when dealing with these little babies, delicate babies?
That's a nice question. And in a way, I should start with, like, we have to detach ourselves with those emotional feelings, because most of the decisions are very clear cut and based on the assessment at that particular moment, but we do empathize with parents and especially the moms who go through these cycles and are very emotionally involved in those things. So my nurses, my whole team, including us, all of us, including all the physicians, we make sure that we understand and relate to their mental status and their physical status and needs and cater to their whatever works out to get the most out of this mom-baby bonding.
Yeah.
As you understand, initial phases, we might have to keep the baby away from the mom, but we try to get back to the kangaroo care or what we call the mom-baby contact as soon as possible.
I know there's a lot of stuff that has to do with premature babies, and I'm so glad that you're out there helping support this. Thank you so much for joining us.
You're welcome.